Wonderful. Good afternoon, everybody. I'm Tessa Archibald. I manage the Homes for Horses Coalition. Welcome to our webinar, What to Do Until the Vet Arrives, with Dr. Jennifer Dunlap. As many of our members, I'm sure you're familiar with the mission of the Homes for Horses Coalition, but for those who aren't, I'll share a short introduction. The Homes for Horses Coalition has been active since 2007, when it started as a unique coalition to help horse rescues and ultimately help equines by ending horse slaughter. Today, the Homes for Horses Coalition is led by the Animal Welfare Institute and the American Wild Horse Campaign, and it has almost 500 members who are equine rescue directors, equine professionals, and equine advocates. HHC is dedicated to providing spaces for collaboration and connection within the equine rescue world, as well as continued learning through experiences such as this one and through the extensive library of resources available on our website. As we get into the webinar, just a couple things of note. The program is being recorded, so no worries if you need to hop out for any reason. Feel free to send any questions in the chat. We'll try to get to as many as possible. And remember to stay on mute throughout so that everyone can hear Dr. Dunlap. Speaking of Dr. Dunlap, she is our wonderful guest today. Dr. Jennifer Dunlap is an accomplished equine veterinarian with specialties in equine surgery, veterinary forensics, animal cruelty investigations, and technical large animal rescue. Dr. Dunlap received her DVM from the Cummings School of Veterinary Medicine at Tufts University and completed her equine surgery residency at the University of Tennessee College of Veterinary Medicine. Soon after, she opened her equine practice, Dunlap Equine Services, in Tennessee. Dr. Dunlap has been investigating animal cruelty cases with federal, state, and local law enforcement since 1998 and has served as an expert witness in court as both a forensic veterinary expert and an animal cruelty investigator. She is a technical large animal rescue instructor and the founder and president of Animal Response Foundation. As the incident commander for the ARF Rapid Response Rescue Team, Dr. Dunlap coordinates the rescue of downed horses, horse trailer accidents, natural and man-made disasters, and animal cruelty cases. In addition, she manages the day-to-day operations of the ARF Equine Rescue, which shares a complex with her veterinary practice. Dr. Dunlap's extensive experience conducting and teaching animal rescue makes her an invaluable resource, and we're so grateful to have her with us today. With that, please, Dr. Dunlap, take it away.
Thank you very much for having me. It sounds like I lead an exhausting life.
Truly, it's very impressive.
So I've broken this PowerPoint up into two sections. We're going to go over the basics of equine response equipment first, kind of go over just the things you can keep in your own truck. And this is going to probably be geared a little bit more towards people who are from equine rescues going out on responses. And then the second half is going to be regarding what to do until the vet gets there. So without further ado, let's get going. So one of the first things we have to consider is the emotional well-being of our responders. And it's very, very important when you head out on scene, whether you're a rescue heading out for an animal cruelty case, so this is a legal case that's going to be heading to court, or in a natural disaster, is that you're self-aware and understand what are your capabilities. What are you going to be able to do? We don't want to put ourselves in a bad spot. We don't want to put our team in a bad spot. And we certainly don't want to put our victim in a bad spot. So we have to think of ourselves, our own safety, because if we're not safe, we're not going to be able to help our team and we're not going to be able to help our victim. So it's one of those things where, a really good rescuer is going to be a really, really self-aware person as well, to know what they can do and what they can't do. And so before we even head out on scene, we want to think about what do we need so that we can be at our best to help that horse. And we use a lot of cask helmets. I like the ones that have the high-vis stickers. You can get them with the stickers already attached or order them and attach them. The benefit to that is if you are responding at night or into a heavily wooded area, you're easy to spot. We've had some terrible storms here, and my vet student, Nick, and I responded to a farm where they had a lot of trees down and horses trapped under the trees. And so we definitely needed our high-vis helmets. You do want to wear gloves. And the easiest ones to get are just the $22 ones at TSC, sort of the mechanic gloves that have some padding in them. Because some of the things we do, they can cut your hands up pretty good if you're having to handle barbed wire, if a horse is trapped, or you're having to pull on a rope with quite a bit of force. We also want to have a headlamp. The benefit to having the headlamp is that you're going to free up your hands. I use the Petzls. Those are my favorites, but everybody has their preference. And then again, going back to, are you at an awareness level where you've taken some training, you've done a few cases, so you're aware of what's going on, or are you a professional? We wouldn't want a team of a group that's at an awareness level heading out, for a federal case. But we would also, we want to get our sort of beginner rescuers in with rescuers have more experience, because that's how we all learn. And most importantly, comfortable and secure footwear. This is critical. I've seen, a couple of times I've seen people respond in flip-flops or Crocs, and I can hear their toes screaming, from where I'm standing. So you do want to have footwear, because again, if you slip and lose your footing and you go underneath a 1,000-pound animal, it's, the likelihood of you surviving without some significant injuries is, it's going to be very unlikely. And so the things that you want to keep in your truck, if you are going to be responding on a fairly regular basis, I have a go bag. I have a backpack, and I can keep some changes of clothing, jackets to suit the season, some money. We were out on a horse rescue once. I had 10 cents. I'd forgotten my wallet, desperate for a bottle of water. And, I kind of learned my lesson, where I had 10 cents to my name coming back in the truck. And so from then on, I stashed some cash in a go bag. And just equipment that we might need just to stay out in the elements, as long as it's going to take to get this victim to safety. That bottom right picture, a picture of Sailor, a horse that had been trapped in floodwaters, and it was 19 degrees that day, and he'd been trapped for 4 days. And so at that point, the skin was going to start sloughing off his legs. We had dry suits on, but we were lucky that we had sort of our winter gear so that we were able to get in there and get him out. And then the basics that we want to have, and I think this is a real key takeaway point, 99% of the time, this is all we really need to stage, what might look to the public as these spectacular rescues. Because we are able to use tarps, and we're going to talk about that. Your best friend is going to be your tow rope, and you can get those at TSC. You can get some equine rescue specific ropes that are a little flatter. We use both, but honestly, the tow ropes, they work fantastic. I like the ones without the hooks, so that you don't, swing a hook and hit somebody in the head or hit the horse. But you want all of your equipment in working order. Good lead ropes with heavy duty brass snaps. I like leather halters, and maybe that's because I've responded to too many cases where the nylon halter, the horse's head had grown into it as they grew. And then we also want to consider, as any of us in equine rescue know, a lot of equine rescue is made up of stallions and pregnant mares. And so we do want to have that nicely padded brass shank if we're going to be bringing a stallion out of a barn to load up into a trailer to get them off scene, something to control their head if we need to. And then a heavy duty large tarp. There are a lot of commercial products available, a lot of skids, and we use those. But honestly, I used a large heavy duty tarp for many years, and we're going to go over some photos, which will show you where you can fold it up, run your tow strap through one of the folds, and you can actually pull a down horse out of whatever area you need to move him from. And then I like to keep pool noodles on hand. We're going to have some case examples where I'll show you where we use those. Lightweight, you can slit them real quick with a knife and pad areas if you have a trailer accident where that trailer is really taking some hits, and you need to pad some sharp edges so that you can easily fold the horse up on the tarp and pull them out. Your pool noodles can't be beat. They are going to hold up, and you're going to be able to shift the horse out of the trailer with the pool noodles blocking the areas, where maybe you've had to cut it, the fire department's had to cut it, or the trailer is trashed and you need to get them out. And then you can never discount the tasty snacks. What we like to do, we call it the snack bucket, and it's basically a combination of Purina Senior alfalfa and some sweet feed to lure, obviously a very starved horse. We're not going to want to feed them that. But if we're trying to lure one over to a trailer that's a little bit reluctant to move or it's uncomfortable, it can go a long way. And then we want to have an appropriate trailer. The things that we want to consider here is, is the flooring in good shape? Is the trailer in good shape? Is our equipment in good shape? You want to keep, as we all know, you want to keep your equipment in peak performance. Even more important in a legal situation where, you're removing their property from the scene, their horses, you're trailering them. And if it's a trailer that's got a lot of issues with it, you just don't have a leg to stand on liability wise, and you can get in a lot of hot water, not to mention, most importantly, the horses could be injured. So, always want to keep your trailers in good shape. And so rescue equipment that I always like to have with me. And it's no matter how many times I'm at a scene, any photo taken of me, it is always an image of me and my RBF. So apparently my resting bitch face is a piece of equipment that I take with me everywhere. This was a trailer accident we responded to, but it's, again, those tarps, knives, ropes and straps, the pool noodles, the bolt cutters and the wire cutters. And the nice thing about that equipment is that equipment can have a lot of impact in a very small space in your truck. So it's not where you need a lot of special equipment to bring this on scene. So on that, on the bed of that truck, you can see I've got some high-vis jackets. You can get those from any of your Uline, any places that sell, sort of some factory or warehouse equipment. And then the tow ropes and the foldable knives, and then a helmet. But that's all gear that you just don't know what you're going to see if you get called out. There's the horse trapped in the fence. Luckily, he had his wire cutters, was able to cut it. And then in that bottom photo, you can see my green pool noodle and some towels patting her back until we can get that horse out of the trailer where she flipped out on. So we always want to have a rescue game plan. Anytime I get a call, in this case, it was actually a client's horse. This horse is a heavily built, impressive border horse who has HYPP, and he is managed on a potassium wasting diuretic because his disease makes his potassium rise to the point that he collapses. But in this case, his dose had to be adjusted. But whenever we get a call, we want to run through our mental checklist of what are we going to need. And in this case, it's super helpful if you have a person that's taking photos for you before you ever get there. So in that top left and bottom left photo, Tim, who arrived before the rest of us, he got some real quick pictures, because what that allows the rest of our team to do is we were rolling back to the clinic to pick up equipment. We knew there was a down horse. We knew he was in the barn. And with those photos, we can immediately assess, okay, that wood above that horse is not going to be heavy enough for us to throw a rope over and attempt to get this horse up standing that way. So we were looking at having to go ahead and roll this horse onto a tarp or one of our rescue skids and pull him out of the barn if we couldn't get him up. And so that's something, immediately we knew with the photos, here's the equipment we need to grab. Here's how many people we likely need for this down horse and the equipment we need. And then we're going to map out our plan based on the animal. In this case, I know this horse very well. He's a total love bug, really easy to work with. But any horse can do anything at any time, as we know. And you really want to put people where you need them. That's one thing I love about rescue is good rescuers leave their egos at the door. In the bottom right photo, one of the team members who's also a certified vet tech, she's holding on to his head and I'm scrubbing him for a catheter. And then in that top right, Josh, the tallest member of the team, is squeezing a bag of fluids into Chappie. It was dextrose, or basically sugar, to get the potassium to go back in. Once we got enough of that fluid into him, we were able to get him to hop right up. So it just goes through this assessment we do, be prepared, pictures to size up scene if you can. And there's a cute little kitty. staff
Oh,
you
Thank
need,
you.
the equipment, and then map out what your plan's going to be. So one of the most helpful things that we can have in place is rope assists. And the benefit to a rope assist is it's stabilizing the horse. You can run the rope far enough out where you're not directly behind or in front of the horse. And that can really help. In these first two photos, this is Romeo. We took in this summer. He was a 3-year-old. Well, I say unhalter broken, but he had a halter embedded in his head. And it actually was not even a halter. It was where somebody had wrapped a lariat around his face to fashion a halter, and the knot was cutting through his head. So you can imagine he's not going to want to have his face touched. So what we did is he was very upset, in a lot of pain, not really halter broken. So we actually pole darted him with sedation, let him get droopy, and then eased him out of the trailer with a soft padded halter set above where the lariat had cut into his head, and then used a butt rope to steer him where we needed to go. And, one thing that we'll see in that photo on the left is the butt rope is really scooping him under his butt cheek. We always want to make sure that the tail is out of the way. That's part of their spine. We don't want to put pressure on it. And then the head rope is just directing him. We had a person on each side of his head, and we're just easing him, but we're driving him with that butt rope. The butt rope is directing the pressure that we're putting on him, because we don't want to fight with their head and get him upset and unbalanced. And then in that third photo is one of my pre-vet students this summer. We dealt with the down horse. She's got her gloves, her helmet on, and she's working in front of the horse, where we're not ever going to want to get into the danger zone between the front and the back legs. That's an area where you can get your legs swept out from under you, and down you go. And then we don't only have the horse victim, we got a human victim, and everything's got to stop with the horse victim while the human victim gets taken care of. And in that last photo is what we call a rear assist rope. And what that is a toe strap laid over the back, run through the back legs and pulled up, and we can back a horse out with that strap. If they get into a tight spot, that can give them some help to back out. If they're backing out of a trailer, maybe they backed out where they've wedged themselves between some trees, but that rear assist rope can be very helpful. And we'll have a video clip of a front assist rope that we use as well. But again, you'll notice we basically got helmets, gloves, and straps. And you can really do a lot with that. And that the tarp in the picture is just to keep my stuffed animal from getting dirty. There was no other reason for the tarp in that image. So in this video, this is where we're using a rear assist rope. This was a cruelty case that we got out on scene on for a stallion who had been locked up with no food and no water. Heat index inside the barn was a good 110 degrees. He was so dehydrated, he was looking like a prune. And then when we got there, this horse was kind of hanging out over a stall, and they said, are you taking him too? Because he can't stand up and his feet are bleeding. And we did not know we had a second horse. So again, we stopped for a minute and said, okay, we've got 2 horses, one's a stallion. What's our game plan going to be? So we loaded up our stallion, got him back so he could get on fluids. And then we worked on this big gelding. He was a racehorse whose feet had been it was one of the worst butcher jobs I've ever seen. And his feet were all bleeding, and barely could move. And this barn was so low slung, so narrow, that we ended up where we had to walk him out of there. And we got some pain meds on board, as much as we could safely give him. And then in the video, we're using a rear assist rope. Again, the tail is over the top. That rope is in that curve of his booty. And then you'll notice, if you can see in the video, the front person, you're not putting a lot of pressure on the head. And we do have that snack bucket to tempt Big Red to keep moving. So here we put people where we need them to be. The two guys in the back, Nick's on the left, one of my vet students, they're the two strongest people, so they're on the butt rope. And then you hear the one person talking about what we're doing and guiding. And that's our point person. And you can get a lot of heft with that butt rope. So we've always got that one person who is standing back, looking at the scene and letting us know, hey, is there something coming our way? Is there, you know, is that door unhinged where it's going to fall on somebody? So you always want to have one person who is away from the direct scene with the horse, who is directing, who's watching, and that makes everything flow a lot faster. It's very easy to get where you're looking at the tree instead of the forest, and you can get into trouble. Where all of a sudden you're taking the horse down the wrong aisle, and you got to back him up or whatever could happen. But then we've placed strong people where we need him to be at the rear assist rope, and then we immediately get him onto the heavy padded trailer, and off he goes. Whoop, it's playing again. Hang on. And so this is where we used a variation, the same horse, once we got him back to the clinic. And in this setup, we actually have a stall in this barn where we can drive our trailer right into it. So we do this for horses with fractures, horses like Big Red, who could barely move. And so they literally get, for lack of a better phrase, dumped right out into the stall. So they really don't have to move. And in this case, you'll see as we back this horse out, we had a front assist rope on where it goes over the withers and then underneath in between the two back legs and out the back. And we put some extenders, that's what those black ropes are, on it, so we had plenty of room. And then Lauren is guiding that tail just to give him, hey, buddy, come on, come this way. So that rope is going over the withers between the front legs and then on either side of him. It does not go between the back legs. But what that allows us to do is stabilize his movement and also really get him out of the trailer. He was not moving. And we're like, you can't stay in the trailer. We got to get you help, buddy. And so that's a different technique we can use. So we've got our front and our rear assist ropes. We go again. So these are just some case examples. I'll freeze the video in a minute before we all have a seizure from watching it again and again. Let me freeze it for a minute. I'll talk about it. Oh. If I can. So the Scooter case, he was an older pony that was on scene where they had just stopped feeding him. And they had moved him to a pasture the day before. That's why it looks like he's got plenty of pasture. Could not get up. And so what we used here is we used a tow rope truck assist. And what that is, you have to be very careful with this. I bent the frame of one of my friend's trucks, but Scooter was little enough, and this is my truck. You run your tow straps behind the dually wheels or regular wheels on the other side, run them over the top of your truck and then underneath your horse, and then you can pick them right up if you have enough people. So what we were able to do here, because of the terrain, is go ahead and pause it. Maybe no. Is go ahead and pick him up, and he staggered the few steps we needed him to right into the trailer. And so then what we were able to do once we got Scooter back to our emergency shelter is put the rear assist rope on him, which you can see in this top image. And then we pulled him out with a tarp so that he wouldn't get bruised and banged up on our ramp. and eased him in that bottom left photo onto a mattress. And then with that mattress, we had the tarps that we slid underneath it, and we were able to fold the tarp and then run a tow strap through the fold in the tarp and pull him right into the barn. In his case, he did live in an Anderson sling for 2 months, but then went on to lead a fantastic pony life. But this, again, this is simple stuff: tow straps, trucks, and then the tarp. So that it's amazing what you can do with just that equipment. And the thing to think of, this at least lets you get this horse off scene into a trailer where you can get them to a facility, whether it's your rescue where you've got everything set up, or get them to a veterinary hospital. And so one thing that I would recommend, if you're doing a lot of horse rescue, is to get with Dandy products. They make a lot of mattresses for equine ORs, a lot of flooring, and we have just one of their thin ones. It's about that thin. We put it under our tarps. We can use it to lay one down. It's squishy, and we really get a lot of use out of it. It's worth the investment. And in that, you can get all different thicknesses, all different colors. But we've had one for about 8 or 10 years, and it's held up great. And we shove it inside a tarp where the tow strap is going on that particular layer. And we use the heck out of it, and it's really held up. So this image on the left is where you can see the tarp is folded up to where the horse's entire body is still on it. And then we run that tow strap through it, and then we're ready to go. Now in this image, we're just getting ready to go. We would not, Tim is putting some pressure on that halter in the head. We wouldn't really do that normally. But we would want somebody on the head and the neck to protect it. And we're going to talk about that. But with that tarp and that tow strap, you can move a lot of horses. And so this is another example of where we use some basic equipment. This little mare was getting hauled from one farm to another, very, very inappropriately tiny trailer. And they heard her falling around in there. They pulled over to the side of the road and thought, what's going on? And unfortunately, they opened all the doors, and there she is. She flops out like a fish out of water, and she is so wedged, it put a big crease in her back. And then they climbed over her and started attaching some little tiny ropes. And you can imagine, it was a pretty bad scene when we were called out and got on scene. So it's very hot. So the things that we're going to have running through our head is, hey, we need to take water with us. We need to have a hat on. From this image. So this image was sent to us immediately. We know we're going to bring a trailer with us. This horse is not going to get back in this trailer. She probably would. Horses are very forgiving, but we don't want her to. The horse's head is lower than her body. That's a huge problem. She's got a lot of blood running to her head. That down eye is sitting on gravel. That's a huge problem. Her back is severely wedged, and they've got her pretty hogtied with some janky ropes. So the whole scene just screams, a bad situation. So the first thing we did before anything is we go ahead and use that partition. They had taken the partition out. We used the partition and some equipment that we had to go ahead and level her head and neck up. So we patted her head. You can see my tech Katie's holding towels over her head. We patted her downside, got some eye lube in, and went ahead and got the head secured, and then put some towels in place with some pool noodles so that she was no longer, really working her back over, and we cut all the ropes off. And so, first we got to stabilize the horse, get her secured, and then we're going to take a step back for a minute, get our helmets on, get our gloves on, and then get ropes in where we can ease her right out. And what we did in this case is sort of turned her a little bit with somebody again on the head and the neck. We were able to turn her head and neck, roll her up onto her back, and had our mattress down below, and we were able to put tow straps through and just pull her onto our mattress. We ran some IV fluids into her. Hot day, she's pretty dehydrated and stressed. And then loaded her up in that second picture, loaded her up into our 2-horse trailer, hung her IV fluids, got her back to her farm. Her most egregious, the worst injury was that back wound, where she really worked herself over. But she healed up uneventfully, and that was her in her stall that night. But that's one of those scenes where you see that picture, and the first thing is, oh my God, I got to get there now. You've got, and that is, I still have to curb it, even as long as I've been doing this, where I'm like, wait. What equipment do you have in your truck right now? Do you need to make a pit stop and go get the stuff you really need? Because the worst thing you can do is show up to help and not have the equipment you need and put that horse in even more danger. So again, take a step back. Hey, do I have the equipment I need? Make a detour, get my equipment, get my people, and get everybody there that we need to. So this is just some other rescue equipment we have, but I included these photos because we do want to pay attention to where we're putting our feet. So in that far right photo, that horse is on a rescue glide and he's padded up, he's hobbled, he's ready for transport. You notice that everybody is working from the rear of the horse or the top line. That's really where you want to stay. You don't want to get down there around those feet, get your feet swept out. And then here with Scooter in the trailer, we had his rear assist rope on. Laura's there with the tarp. I'm in the green scrub top on the far side. Nobody is around Scooter's feet because we've got to work with him by either leaning over, or in that middle photo, we have our J hooks. Whether you buy a rescue glide or not, I like my rescue glide, but I'm happy most of the time with my tarp. Those J hooks are ideal because you can reach over the horse, throw your rope over. And for any of my clients watching this, my finger's okay, it's just bruised. The J hooks will allow you to put your toe strap under and then wiggle them back underneath the horse, so you're not having to get anywhere near those legs. So you do want to consider appropriate, if you're going to be doing this, you want to consider appropriate trucks and trailers. That picture on that bottom left, that's probably real. That probably wasn't even a setup based on some of the things we see rolling down I-40 here. But you never, ever, ever want to be under trucked. The thing that, all your truck dealerships, oh, it can tow anything. The thing is if it can tow it, it may be able to pull it, but the big question is, can that truck stop it? If that truck doesn't have the heft and the power and the weight to stop a trailer, you are a speeding bullet heading down the interstate. So you do want to make sure you have a good truck and trailer match. And so, for me, if you're looking to buy a trailer and you have a pickup truck, I would always go with a gooseneck. It's easier to maneuver into tight spots. And the thing is, a gooseneck, I've responded to so many trailer accidents. A gooseneck will rip the frame out of a truck before it becomes disconnected, if everything is connected correctly. You really have to have some shearing forces to take a gooseneck off. I've responded to a ton of bumper pull trailer accidents where the bumper pull became disconnected from the car or the truck as it hit a bump on a road. So there's nothing wrong with a bumper pull trailer. Just make sure it fits right, but it is where a gooseneck trailer at the end of the day is a safer way to go in terms of not becoming disconnected from a truck. We want to consider a big open trailer. Again, it goes back to, rescue. If you're doing a lot of rescue work, it's stallions and pregnant mares and pregnant mares and babies. In this case, it's Emily and Bess was pregnant again. So we wanted to have plenty of room for them to get out. And then consider a stock trailer. A lot of the horses you're going to see in rescue, they may never have been in a trailer before. A big, open, inviting trailer is going to be a lot easier to maneuver them into than a closed up, regular trailer that most of us think of for horses. And I would always get something extra wide, extra tall, because if you're doing rescue work, you don't know if you're heading out for a miniature or a heavyweight Percheron. So it's always a good idea. You can put a miniature in a big trailer. You can't put a Percheron in a little trailer. You do want to have some sliders where you can gut your trailer if you need to move a downer in. And then my preference, because I can pull them right up on my tarp or my rescue glide, I like a ramp because I can butt rope one right up that ramp. Whereas if you put your rear assist rope on one and they're really sitting on you, you can drive those legs underneath the trailer if it's a step up. So for heavy duty rescue work, if you're doing a lot of it, I think a ramp is best. So real quick, I know I'm going long here. I wanted to split my time between emergencies and this, but you want to make sure, again, you have the right equipment and the manpower, and then assess why, if you're responding, maybe law enforcement's called you out as a rescue. Why is this horse down? Assess it for, is there limb fractures? Is there a hoof abscess? Spinal injury? Or is this, on a cruelty case, is it starved nearly to death? If you're a vet, sedate, IV fluids if needed, moving that down horse, tarp and heavy tow straps. The commercially available rescue glide is great. I like mine. I can stow my tow straps and tarp really easily though. Again, that helmet for you, you've only got one head. And then padding and protection for your horse. You really want to pad that head and the eyes. You don't want them to injure those soft, fragile areas. So this is just a picture of little Andy. You got to have humor in rescue. He was named Little Andy because he was in an Anderson sling during the case. So he was in the little one in the Anderson sling, which became Little Andy. This picture is in here because the thing we want to do immediately for a horse that's down is, remind ourselves we've got to prevent nerve damage and eye damage. And the way we're going to do that is we're going to put the horse's head on some towels or a soft jacket. It doesn't really matter. You just got to pad the head and protect the eyes. Get the halter off. We'll leave a halter on one if we're holding the head and really manipulating it. But if they're going to be down for a period of time on a halter, they can get facial nerve paralysis. So we want to cover the eyes, pad the head. And then in this case, we had just started to pull forward that bottom front leg. We do want to pull the bottom front leg forward so that will prevent radial nerve damage. Worst thing that could happen is you have a horse that's down and they're fine, other than that they can't move that front leg and stand up because the radial nerve is injured. So pull the down leg forward and pad the head. So we do want to make sure that we stay on the top line. Horse, as I mentioned earlier, use a hook or a cane to wiggle your ropes. You can have a handler gently tip the nose up to prevent them from getting up if needed. If you watch a horse get up, they really have to use a lot of their head and neck to swing forward and to get up. If we tip that nose up slightly, you really can prevent them from getting up. We don't ever want to put our straps on a lower limb or too tight. We want them to be able to be cut loose pretty quickly or unwrapped really quickly. We do want to stabilize the head and the neck. So I keep harping on that probably. We have to think of the clock as ticking on a downer. So not only do I like to have a person that's kind of standing back, assessing the scene for the rest of us and calling the shots, they also have a stopwatch going. If we have a horse that's down and they're sweaty, they look like they've been there a while, you can see changes in the dirt or the grass where it's like, yeah, they've dug a hole. They've been down a while. One of the first things we might do is flip them over to their other side, which would theoretically be their good side. So the side that's not down, the muscles aren't bruised or numb, and see if they can get up that way. And a lot of the time, if it's a horse that's just stuck, maybe their legs are uphill, we can roll them to their good side, boom, they're up. So that's one thing to think of. Again, paying attention with your safety. But if they're down for more than about 4 to 6 hours, we start to get into some muscle destruction. Myoglobin, so a chemical in the muscle, releases, and that causes kidney and multiple organ failure. And then we can get into neuritis, the radial nerve paralysis we talked about, where we want to pull that down forelimb forward. So we're going to moving the down horse. We got to secure them, stabilize them if needed. And then we always want a person at the head watching the limbs. That, again, that point person directs, and the rest of us have to pull. I've called by farrier, who I think is literally the strongest man on earth. Many times I've been like, Daniel, I need you to come out and pull this horse for me. So you do want to have some pretty physically strong people pulling on it. We had one case where we had to pull Henry, a pony, 1.5 miles because of the terrain. We couldn't get our trailer any closer, but boy, you sure do want to get your trailer as close as possible. So this is just some examples of some down horses, from some of my cases, and that one in the middle left is one I just shamelessly stole off the internet. So that again is that photo of Scooter where we use our truck rope assist. The one in the top right is Sophie, where she was down, elderly. We prompt her up with hay bales because that just kind of helps right them mentally. You know, where if you can at least get them sitting up, you're preserving, their organs a little better. They're not necessarily crushing their muscles as much, and they're a little more alert. So we gave her water, food. We had her on the tarp, and then we were just waiting for our trailer. And there's somebody there with her. Katie's there with her. And then just another photo of Scooter where we're about to pull him onto the tarp. And the yellow padding there, we use that if we have a horse where we really need that head padded up, buckle it on, it's good to go. I've even put some of my blue towels in there before where the whole eye is protected. And again, there's another shot of the rear assist rope. And this is the one in the middle on the left. The guy in the blue shirt and the tan pants, he's in a really dangerous spot. Even though the horse's legs are hobbled, he could still get a kick to it. But you can see where they've got the rope underneath and the horse's head is padded. Okay, so that ends that section of it. And now we're going to move into what to do until the vet comes. Do we have time for questions here or should we move on?
Maybe like 5 minutes of questions,
Sure.
3 minutes till 45. If
Okay.
anybody has any questions, feel free to unmute yourself or throw them in the chat. We may be good to move forward then.
Okay, I've got a shell-shocked audience. All right. Okay, so this is a big deal, obviously, for any of us as horse owners. What are we going to do until the vet comes? I wasn't always a vet. I was just a horse owner myself and full panic mode if my horse was injured. So it is obviously a very panicky situation if your beloved horse is in trouble. So we want to have, and I think one of the themes maybe running through this whole hour is be prepared, be prepared, be prepared. Before your horse ever has an emergency, have a game plan. And so we do, not having an emergency plan is a disaster itself. So you want to have, what is my game plan? Do I have a trailer? Do I have a friend with a trailer? Do I have an emergency kit? And we're going to go over that. We want to maintain a relationship with the veterinarian who does emergency work. I do a lot of emergency work. It's one of my favorite things to do. But there are vets who just do lameness and they don't do emergency. So if you are, shopping for a new veterinarian, say, hey, do you do emergency work or do you have somebody you refer to? Because you don't want to introduce yourself to a new vet at midnight. You want to say, hey, it's me, and have that vet know who you are immediately. So some emergencies we have to keep in mind, they're just too big for a farm call. So that horse may need hospitalization. So if you don't have a trailer, know somebody who does. And then, one thing I think more vet clinics are doing, I know we do here, Lauren, my sister, who's also my head tech, we haul patients into the clinic if needed. So I think other clinics are doing that as well across the country. Make sure your horse can be touched all over. That is the nicest thing you can do for your veterinarian, is make sure your horse is used to being touched. It's very important, for it not to be where we've got a hind end injury on a horse that's never had his legs touched. It's a disaster for the horse, the owner, and the vet. So that's very important. If you have one, more and more people are getting rescue horses. The first thing I do if I have a horse that I can't really touch, I get my trusty pool noodle out and pool noodle them all over, because if they kick the pool noodle, no big deal. If they kick me, it could be a big deal. So that's the first thing that I do just to get them used to it. And then we want to have an emergency kit in place in our barn that we don't borrow anything from. So this talk could be, I could spend days on this. So I limited it to how to set up your emergency kit, wounds and laceration care, and then colic. So for your emergency kit, you do want to ask your vet or somebody who already knows how to do it, how to do a TPR. So temperature, pulse, respiration. You can get a pulse with just the back of your hand shoved behind your horse's left elbow. So you can do that without a stethoscope if you needed to. But I have a preference for the Littman stethoscopes. You can order them on Amazon. I think the sound is really, really good. And then just a Vicks thermometer. It's a fast read. They hold up living in the barn life. And then a waterproof container kit. And all you have to do is go online and look for waterproof storage container. The picture in that top side, that black line around the top of the container is actually foam. And when you lock that lid down, it's pretty darn airtight. So that's what we keep emergency kits at the rescue in. That's what I keep a lot of equipment in my truck in. And then you also want to have some things stocked in there. Banamine paste can be your best friend if your horse is colicking or they're sore or they have an injury. And then bandage supplies is something we always want to have. Our number one emergency that we get called out on is wounds and lacerations when it's not colic season. Vax are my favorite. I've had some of those for a long, long time. I get mine at Big D's tack shop in Ohio, very reasonably priced. And like I said, they're washable. The nice thing about the Nobo, which is pictured in that lower left for bandaging, it has a foam core. So you could theoretically, even if you don't really know what you're doing bandaging, you can crank it pretty good and have less of a risk of injuring a horse if you weren't, instead of using a thinner bandage. And then the standing bandages pictured in that top right, again, I've had some of mine for 20 years and they really hold up. So we do want a stethoscope. You want a thermometer in there. If your horse goes off feed, is it colicking or does it have a fever? If a horse with 103-degree fever, they're probably not going to be eating. I know of one patient that would be, but most won't. So that TPR is critical to be able to get. And then just some gloves and then betadine to clean a wound if you need to. Main thing you don't want to do is borrow things out of your emergency kit because it becomes an emergency itself if you can't find it during an emergency. So penetrating wounds, if we're dealing with those, we don't want to move the horse. That top picture was a mare who had a pitchfork. The owner had left the pitchfork in her stall and, God only knows how the mare ended up shoving it to her groin, but she did. She did fine. We were able to, we pulled it after we ultrasounded it to see where it went and then treated her for a large open wound. I mean, obviously very gruesome, very graphic. But the owner ended up where she taped it to the opposite leg where it was pressing. And then her husband came and took the pitchfork part off so it wasn't touching the ground. And they just stood with her in the barn aisle till I got there. We don't want to pull a foreign body out unless there is a risk of further penetration. So if a horse has stepped on a nail, we have 2 of those actually in the clinic right now. If it's really sticking out far and you're like, he's going to put one more step down and he's going to take it in 2 more inches, go ahead and get it out and then bandage that foot so we can follow the tract. But if it's already flush with the foot, it's embedded or something like this horrible pitchfork in the groin, leave it, and then we're going to take care of it when we get there. Be ready. God forbid the horse, gets excited and things start bleeding or the pitchfork moves as in that mare. Be ready with padding and bandaging. You can use a pillow, your Nobos, anything that's absorbent will work. Penetrating wounds are always, as you can imagine, that's an emergency. That's a 911, your vet needs to go now. We do want to keep the horse very calm. If that means that the whole barn full of horses needs to stay in with that horse, so be it. But they do need to have their horsey friends nearby so that they can stay calm and happy until you get there. So when we have wounds, one of the most important things to know how to do is to bandage. That is one thing you can do. That is a lifesaver. You can save your horse's life if you know how to bandage. And that's something obviously you would do before the vet even gets there, get that wound secured. But you do want to know how to do it appropriately. Horses do not have that much soft tissue coverage on their lower limbs. It's why lower limb wounds are so hard to get to heal. They have a lot of blood vessels down there on either side of the leg. And then they have synovial structures or tendon sheaths and joint capsules. If those are penetrated, it's life-threatening. So it is very important that, that Nobo and track wrap, it's just a real easy bandage to have because you can't really mess that up too much. That's what's pictured over in the top left. That's what I use. And then you want to know how to bandage a hoof. You can have some diapers, some duct tape, some vet wrap, And if you know how to do the bandage on that top left, you can bandage any leg. You just, in this top picture in the middle, he's doing a stack bandage. You're just layering bandages up the leg. So it's just another variation of that classic standing bandage. You know, maybe the wound is way up high. You're going to keep bandaging until you get it covered. But very important to know how to bandage and have bandage supplies at the ready, because, you know, it's, as a lifelong horse owner, if horses can find something to get into, they will. So the other things to remember with bandaging, vet wrap should never be applied directly to the skin. It seems super soft and stretchy. Seems like it wouldn't be a problem, but I've had it cut full thickness like a razor. So you always want padding beneath your vet wrap. You can get a bandage too tight. If you were just to really crank on it, you could bow or injure their tendon or cut off blood flow. When I was a surgery resident, we had a horse come in who had stepped through a fire pit at a campground, and the owners used bungee straps to tourniquet the leg. There was no pulse in the leg, and I warned him. I said the blood flow may be cut off, and there's nothing we're gonna be able to do. Ended up taking him to surgery, repaired everything, and then about 2 hours after surgery, we actually got a little pulse going, and the horse did fine. But I mean, I don't know how much longer he could have survived with the bungees on his leg. So we don't ever want to use a tourniquet. The veterinarian putting a tourniquet on, the timer is on, it's a wide strap. It's for a specific purpose that, I like to reset them every 20 minutes. But putting a tourniquet on in the field just to stop bleeding, you really don't need to. The main thing you've got to do is, if it's bleeding through, put another layer on and make sure that it's snug enough. Not crank it, but snug enough. Just keep adding layers and it will stop it. And we don't ever want to do a narrow bandage. So I included that picture on the far left because that little vet wrap around the leg, you can see how swollen his tendon is up above it. It gets painful, and that it can cut him, and it's just a very uncomfortable situation for the horse. So main thing is, you don't want to get it too tight. You don't want it to be narrow. You want it to really be a long, thick bandage. And if you've got strike through or it's still dripping, just keep adding more layers, because the thing that you can do is you don't want to keep breaking the clot by taking all the bandaging off. So, one thing that we want to keep in mind, how much is too much blood loss? The image in that bottom left was a patient of mine where she completely lacerated the digital artery vein nerve bundle. And she was pumping it on out of there. She lost about 8 liters. And, you have to kind of eyeball the ground. So we immediately got a bandage on. But a 1,000-pound horse has about 40 liters of blood. It's a lot. And it can be very dramatic when they do bleed. So between 6 and 8, unless it is just boom, it's gone from them, where they are really, really, feeling shocky, we're going to give regular IV fluids. So that would be plasmolytes and LRS, just the regular bags, that all of us have seen. If they're losing more than 10 to 12, they're going to need a blood transfusion. That's getting touchy on whether they have enough blood to maintain bodily function. We can certainly bump them with IV fluids, but that severe anemia that sets up is going to be a problem. So we actually do have 3 blood donor horses here in the area that we'll use for blood transfusions. In horses, blood transfusions, we think of it as the first one is free, where you can get one of your blood donor horses, go ahead and transfuse them. And then they might react the second time, but by and large, most horses are not going to react to that first transfusion. But again, the big deal is getting the bandages on, getting the bleeding stopped. And then, if you can, be able to show your vet, hey, here's the puddle, here's where it happened. And then that way we can assess, and often we can tell, obviously if the horse is down, he's passed out, that's a pretty good indicator that he's going to need some serious fluids and maybe a transfusion. Heart rate, is he stressed? So a lot of ways we can tell if we're going to have to go that route. So just to recap on the wounds, if they're profusely bleeding, get the bandage on ASAP, apply more layers as needed. If it's on the head or around the eyes or a body cavity, do not touch, just wait. We don't want to squeeze things into the eye, try to rinse an eye out. Horses, a lot of them will get a thorn in their eye or a foreign body, and that can actually drive that through the layers of the eye and cause a big problem. So just leave it until your vet gets there. That's the key takeaway. If you can't see the full depth of the wound, just wait on your vet. If it's a minor wound, it's okay to clean, then bandage. But if it's a big wound, just get that bandage on there ASAP. And if it is a puncture, that is an emergency. So a body puncture, we don't want to flush those out. What that can do, if you're flushing it, that can drive liquid and air through there, make everything separate. And then you're actually driving whatever, if it's a piece of wood, whatever, you could be driving it further into the body, into the muscle. You could also be sending air in there. And the biggest issue we see with horses that have pretty large scale puncture, especially in the chest or in the hips or the legs, is it will suck air. And you'll get what's called subcutaneous emphysema, where you get a snap, crackle, pop in the skin. And it can get bad enough where I've had to put emergency tracheostomy into a couple of them because the head swells so great they can't breathe, since horses can only breathe through their noses. So if it's a puncture, a lot of these serious, horrible ones, just sit tight and get bandages on where you can. Oh man, we're running out of time. All right, so for quick on the colic, again, game plan ahead of time. Always consider, is surgery an option for that horse? That just speeds up the decision-making process in the event it's a really bad colic. So it's great for all my clients if they have some Bandaging, because lots of times if it's a little if the horse is a little gassy, give it some Bandaging, walk it a little, good to go. Fantastic. Next step up would be treat on a farm with fluids, then treat in a clinic with oral fluids, IV fluids, and then surgery. So in that bottom picture, one of my fillies had to have surgery at Rood and Riddle. She herniated bowel through a hernia that she had in her belly button. She was one of our rescue, actually one of the fillies pictured in a previous photo from our rescue. So with a colic, you want to look at the horse. Is it just a little off food? It's not wanting to eat, but it's kind of looking at you like, I don't feel good, but I'm not too bad. Or is it like this horse in the top photo where it's rolling, it's thrashing, it's profusely sweating, it's a danger to you and to itself? First thing we want to do is get the hay and the food out, check in with your vet, give Bandaging if it's appropriate. If no better in 40 minutes, you need a vet. If it's one of those, it's just a little off. If it's one that's already rolling and thrashing and sweating, call your vet ASAP. That can be a dangerous situation for the horse. And walk it, for about 10-15 minutes. That's plenty. Sometimes we can put them in a trailer, and I've been on the other end of it, waiting as the surgeon in the OR, thinking this horse is definitely going to go. Horse gets there, we work it up, do the rectal exam, and it's like, everything's back in place. You can't discount the bumpy road trailer ride that will bounce gut back where it needs to be. And then keep in mind, be safe. If a horse is thrashing and they are in that level of shock and that level of pain, as much as they love you, they are not paying attention where their legs are flying, and you can be gravely injured. So you want to get the horse out into an area where everybody can be safe. So one thing, I heard a lot is somebody will say, I walked my horse all night long and he finally stopped colicking by morning. And the reality there is that horse survived in spite of what they did. Because if we are walking a horse to the point of exhaustion, you're moving the blood flow from the gut to the muscles, which can make the gut problem worse. So, if we're having to hand walk a horse, like one here, we'll see a lot of them in the winter. They come in with impactions. It's a big one. So we're bumping it out of them with IV fluids and oral fluids. And as that impaction starts to shift, they get uncomfortable. So even here, we walk for 10 to 15 minutes, about 1 to every 2 hours. And that's plenty. That gets the gut moving, but we're not exhausting the horse. So that's something to keep in mind if you're, told to walk your horse. If you do have to haul a colic, get them in as big a trailer as possible so they have room. Bed the floor with shavings for secure footing. Consider not tying them depending on what your trailer setup is, so they don't try to go down and then there's their head hanging. And as it's not harsh, but as hard as it is to hear, you cannot do anything for your horse on the side of a road. If they go down in the trailer, you got to just keep going. Because the reality is the help for the horse is at the end of that trailer ride to wherever you're headed. And this was kind of an awkward slide, but I wanted to throw it in here because I've seen this issue. A lot of us have Acepromazine in our barn cabinets. It really does not have a place in emergency care. So I've had a few people say, oh, I gave him some Acepromazine, he's laying down now. Acepromazine is a fantastic tranquilizer and it's an anxiolytic. But it's not good in emergency care. It can cause enough blood vessel dilation where you can drop a horse, especially the older the horse gets. You can make them pass out due to blood bottoming out of that blood pressure. And ACE can also and will also paralyze a stallion's penis. So that is the last thing we'd want to give to a stallion. So it's just, we all have these medicines in our cabinets. Everybody's got Bandaging. A lot of people have Acepromazine. But again, in an emergency, it's just not a drug you want to use. Okay, so that is Big Red, the cyst on a couple of weeks ago. I took that pic. And then Domino, the horse at the start of the vet care, he was actually attacked by dogs, but he's done fantastic and he's in a new home now. So this is all my contact info. If anybody has any questions or comments or wants to reach out.
I have a question.
Hey, Ann.
Candy couldn't see this video because she had to go somewhere, but is there any way it'll be repeated in the future or how she could see it?
Absolutely. So this meeting was recorded. So
Okay.
in the next few days, I will publish the recording and I'll send it to everybody who registered. So it will be right in your email inbox and you can share it with them.
Great, thank you. Also, Jennifer, do you carry IVs on your truck with you, or
We do have an emergency stash on the truck. Yeah. If they need more than our emergency stash, we'd probably want to put them in the clinic.
Okay. Yeah. Okay. Well, that was very interesting. Thank you, guys.
Thank you.
Hope you like my cat because now he's disappeared. Now no one's on.
What's a talk without a cat? We gotta have some help. I couldn't bring Miss Muffins into my room, so
yeah.
Cat, so
Okay. Thank you.
thank you.
We had a question from Carol about choking on grain.
Yes.
I don't know if you have any insights related to choking.
I got the chats right here. Let's see.
Yeah.
So with choking, if your horse is a chronic choker, the things that we'll do is if they can handle it, we'll maybe move them and if it's a senior, we may be stuck with senior feed, but if it's a younger horse that's chronically doing it, the first thing I'll try and do is move them over to a sweet feed, which makes them less likely to choke. I own one that's a bad choker, so he's on Omaline 500. The other thing to do is we can put their feed in a tub, literally a water tub, and I sprinkle it about so they have to forage for it. The other thing to consider doing is I've actually swept the shavings back off the mats and sprinkled their food in their straw. So again, they're foraging for it, because most of the time it's where they're taking a big mouthful and it wides into their esophagus. So that can slow them down. You can put river stones in there, so they have to nudge those aside, but lots of times they get wise to that. And feeding a horse, what I'll do first is offer them hay, let them eat for 20 minutes on their hay, and then give grain, and then separating that horse out for feeding and giving a solid hour to eat. That's what, we see a lot of horses come into ARF or Animal Response Foundation who are chokers because they're like, oh my God, I've got food for the first time in my life. And we really have a very regimented, here's your hay, you get 20 minutes to eat your hay. Now we're going to give you grain and you get 45 minutes to eat that. So if we can make a timeline where it's really long like that, that can slow them down too. But most of the time it's sort of some physical interventions we put in place.
Does anyone else have any questions? I see Katie asked about foaling and delivery, but that's a whole nother subject.
Yes, that is.
I have
Linda?
a question. Yes. So if you have an older horse, I've got a horse that's 27 and we've pretty much put her on what we call hospice.
Yeah.
She's very, her top line's very thin. She's, walks a little slower than normal, obviously has a little hitch in her step, but she's still eating all of her food. She's still happy. So we have her on what we call hospice. If at some point she goes down and can't get up, in reference to what do we do until the vet gets there? Is that, would I still try to, I noticed you had one horse kind of sitting up with hay, bales of hay
Right.
around her. Should we try to
Right.
get her to sit up? Or if she's on hospice, do we just let her lay completely down until the vet gets there?
I really let the horse tell me,
Okay.
I'll put a halter and a lead on them and say, hey, you want to sit up? And have somebody gently easing their head up, and then somebody grabbing that mane and kind of rolling them. And if they desperately want to sit up, then I'm going to prop them up with hay bales and let them sit tight. You also have those horses. I had one this morning. He heat stroked. Our temperatures here are just ungodly right now. And he didn't even want to lift his head. And so I think she'll probably be the one to tell you whether she wants you to prop her up, maybe give her some sweet snacks, while you're waiting for the vet. But something like she'll tell you.
Great. Thank you.
You're welcome.
All right, I think we will close out there. Thank you so much, Dr. Dunlap, for all the incredible information, and
Thank you.
in the chat, everybody was super grateful for all of that.
Thank you very much for having me.
Absolutely. Everybody have a good afternoon. Bye-bye.
Yep. Take care. Bye-bye.
Thank you.